great pleasure for me to introduce you to Dr. Mandisa Greene. Mandisa is the first Black female president of the Royal College of Veterinary Surgeons and is also a small animal veterinary surgeon herself. Mandisa has qualified from the University of Edinburgh School of Veterinary Studies in 2008 and started her career working in Scotland, but has now recently moved to the West Midlands, where she works in general and emergency small animal surgery. She's also really passionate about increasing diversity in veterinary medicine. So I'm going to hand over to you, Mandisa, now.
Hello, hi everyone, and thank you all for coming to attend this talk. And I'm hoping that I will be able to give you some insight into my career, into my journey, and into how to become a vet. I think it's always, I try to remember being your age when I was thinking about this talk and really remembering not being very sure of where I was going with life, because there was so much happening at the time. So really hoping to just speak to you to maybe inspire you into considering veterinary medicine and generally veterinary medicine specifically, but sciences more generally, so science, tech, engineering, medicine, maths, just generally as well. So I'm going to start sharing my screen and talk you through what I'd like to do today. Okay, so can everyone see that and hear me fine?
Yeah, that all looks good to me.
Okay, wonderful. Okay, so I would just like to start off with a question first, if I may. So how many of you know a vet or have ever visited a vet? So do you know one personally? Is there someone in your extended family or social circle who is one? Or have you been to the vet? Or have you actually never met a vet? So I'd just really like to know that before we get started.
So there should be a little poll on your screen, but again, if you're having any difficulties finding that, or if you're on a tablet or a mobile, you can use the chat box as well. But it looks like most people haven't met a vet before, which is interesting.
Okay, so that's really good to know, because I think you know, when I should start off with letting you know that I was born in London, but I actually grew up in Trinidad and Tobago in the Caribbean, and I knew lots of vets. And when I came back to England to try to study veterinary medicine, I didn't know any vets. I didn't meet any. I knew nobody who knew one. And it was almost like a myth and a legend to try to find anybody who was a vet. And then when I tried to get guidance, so career guidance, it was kind of almost understood, I think, by the careers guidance people that it was not a career for me. So it wasn't something that people who looked like me considered generally, and that was really strange for me, because of course I had known a very different existence where there were lots of people who looked like me who are vets. And I think what I would like you to consider in all of this, even if you've never met a vet, just consider everywhere in the world. So consider the parts of that are not Europe or the Western world. So let's think about the continent of Africa and Asia, and let's think about the Caribbean. And there are vets there who look like you, and there are people there who have gone through that experience. And so just to get the picture in your head that there are people caring for animals who will share cultural experiences with yours, and so just to make sure that you're not blocking being a vet in your mind just because you haven't seen one or have never met one. It's certainly, I'd like to talk you through the career and maybe show you some of what a vet does. So thank you for that. Okay, so I wanted to get just quickly again a bit of a history of Black vets in the United Kingdom. So the term Black is actually in this case is a political term. So this goes to the ethnicity of anyone who shares an ethnicity, either Black, Asian, or minority ethnic in this circumstance. And so you can fill in the poll for us. Is there a poll for this? And just see what year did the first black vet qualify in the United Kingdom. So is that 1786, 1886, 1986 or 2006?
So it's like lots of people have voted so far. Again, if you can't see the poll, feel free to put it in the chat box. But it's like most people have gone for 1986. About 70% of people have guessed that, and there's a good split amongst the rest of the votes.
Thank you. So yes, I can see there most people have gone for 1986. So I move that, and I want to tell you. Oh my. So the correct answer is 1886. So the first vet to qualify qualified in Edinburgh, Jotelo Soga, and he went to Edinburgh University in 1886 and was the first black vet. And we've had quite a lot of black vets qualifying, it's just nobody knows. So just to remember again that there is a long history of people studying how to care and look after animals. And so for some of you, I'll go on to talk about pets in a little bit, but for some of you, just to remember too that this is not something that's new, but something that has been in the in British culture for a long time as well. Okay, so what we'll talk about today is what it means to be a vet. I want to give you a quick whiz through a day in my life, how you could go about becoming a vet, and top tips for success. Because again, I think when I was trying to reflect on where I was in my journey at your stage, I really wanted to know how I was going to get to where I was now, and I really wanted to know how to succeed, and so I want to share some of those tips with you as well. Okay, so what does a vet do? So if we can put up the options, and I want to talk people through the which one is not a vet question. So I think I've got on there the vet acupuncturist. So this is someone who sticks needles into animals in the certain focal points, in certain points in their body to try to relieve pain. A sheep midwife who helps sheep give birth to their young ones, to lambs. A race course tracker, so that's where a vet would sit in a car and race around the track with the horse, just checking that the horse is okay. So this vet, the job would be to go whiz, whiz, whiz around the race course. Or a zoo vet, somebody who looks after animals in a zoo specifically for wildlife animals. So which one of these is not a real vet job?
We've got 82% have voted so far.
Mm-hmm.
Anyone else going to do a last minute guess? Okay, we're going to put the answers up.
Okay, so it was a bit of a trick question. So all of those are jobs that vets do. So that was me just trying to give you a bit of a trick question, because those are all things that vets would do. So just to kind of point out, I guess, to you that it is a very varied career, and there are lots of things that you could possibly do with a veterinary degree. So when you graduate from vet school, you get a veterinary degree, and that is basically your beginning, and you start learning and you do different things from there, and the options are quite varied and quite many. So just to kind of show you visual picture of the different types of animals that vets would look after. So obviously you've got your farm animals there. You've got fish, you've got your wildlife, so your elephants and lions, but you've also got your race horses, and you're also your pet ponies and pet horses as well. So quite a lot of animals in there. Now, I've put this picture in just to highlight as well that vets don't only look after animals, kind of for clients or for people, or even in the wild. Vets also do things called research. So vets work in labs, and a lot of the time they work on kind of advancing veterinary medicine. So they work on making sure that we have medicine to treat our pets. They can also work on helping with cures for human medications and human conditions. So vets work in labs as well, vets do a lot of work too with what's called the food chain. So in all of this pandemic that we've just had, vets who work in our food chain have been the most prized and the most valued of all the vets. So say, for example, me, who works in a small animal vet, I'm quite low down the chain in terms of priority, because the vets who work in the food chain, their job is to make sure all the food coming into and going out of the country is safe for human consumption. So they check all of the meats that are coming in, and even small things like pies and pizzas and all of that stuff that we take for granted. There are people who are out there with veterinary degrees making sure and testing that stuff and making sure that it's safe for us to consume and for others to consume as well. So vets' jobs are very, very varied. Now, I put this there to also point out that vets are not just medics, as you would call them. So they're not just like your GPs and medical person, but they're also surgeons as well. So vets do not just seeing animals and giving them medication and injections, but they're surgeons as well. So we're what you would call dual qualified. And of course, in medicine, you would become a doctor or a surgeon. You don't do both. But in veterinary degree, you can do both, and you can qualify as a vet with the ability to do both medicine and surgery on a daily basis. So, question, how many of you have pets? I think we've got a bit of options there on the polling question. So options are: I don't have a pet, I have a pet, I have more than one pet, or I've had a pet in the past. Okay, so I think we've got 92% voted, and the majority of you don't have a pet, and a quarter of you have a pet, and some of you have more than one pet or have had a pet in the past. So that's good. I think in terms of the majority of you have either have a pet now or have had one in the past. So I'm at what you would call a pet vet. So I look after pets. I look after your cats and dogs and guinea pigs and rabbits and gerbils and anything that you'd have as a pet. That's what I do. I also work for at times an emergency service. So I do what you would parallel with humans when you go to A&E. So when you have an emergency and you've got to go to see someone either in the weekends or nights or when your doctor's closed and deal with an emergency situation, I do that as well. So I wanted to give you a whiz through what would be a typical day in practice. But I want to start by saying there is no typical day in practice. It is something that is very varied. There is no day that is exactly like the day before. And I think for me, that's one of the things that I really, really love about being a vet, that I go into work and there is I'm never going to have a day exactly like the day before. And tomorrow is going to be completely different as well. So if you like variety and if you want to have something that's always a challenge, I think veterinary medicine might be certainly a career to consider, because it's certainly something that brings something different every day. So a typical day in practice. So I arrive, my day starts at 9 a.m. And I usually arrive at about 5 to 9, 10 to 9, and I get in, get myself ready and go turn on my computer. This is what a typical consulting room looks like. So that's what we call the space office. We call it a consulting room. So I would go into my consulting room and turn on my computer, log on and see who's waiting for me. So usually I won't have to walk past the people and their pets waiting for me. So the people are called clients and their pets waiting for me. And usually I won't have to walk past them. Usually I come in through a back way. So when I turn on my computer, there comes the surprise of how many people are waiting for me. And at any given day, there's going to be at least about 3 people waiting for me. And my job at that stage is to see who needs to me first. So there's a dog waiting with an eye problem, there's a rabbit that needs its vaccinations, and there's another dog which has been to the emergency vet the night before. So again, in terms of thinking which one is more of an emergency, it's the dog that's been to the emergency vet the night before, because that dog has been seen by an emergency vet but needs continued treatment with me. So I'm going to talk you through a case, so bear with me. So this is Henry, and he's coming from the night vet. I've called him in first as my first patient, and his owners are very, very worried because he is not his normal self. So this dog is called a Labrador. It's a black Labrador, and it's usually a very typical family pet. They are very lively and fun, and one of the things they're known for is scavenging. So they eat stuff that they shouldn't. And so Henry, sometimes when he's out on a walk, might be known to eat the odd bit of chip or kebab that's sitting somewhere in the fields. But usually he's been all right. He's 2 years old. This family's known him since he was a puppy, but Henry is not eating, and they're worried. He was vomiting. They took him to the emergency vets. They stopped him from vomiting, but he's currently not eating. And so they want me to do something more because even though he's not vomiting, he's still not his normal self. So I have a conversation with the family and I have some options that I can present to them, but the emergency vets have done quite a lot of work in advance, and I'm just really going to piggyback off what they've done and try to see if I can figure out what is wrong with Henry. So the first thing I do is admit him into the hospital. So I will admit Henry into the hospital and I will pass him over to my colleagues, my nursing colleagues. So we have vets and then we have vet nurses, and vet nurses help and support us to treat animals on any given day. So I'm passing him over to my nursing colleague, and she will make sure that Henry is comfortable. She will put him into a kennel. She'll make sure he has really nice bedding. She will make sure that he already came to us with a bit of a drip in his leg because he has a bit that's in his leg that's ready to put a drip in because he went to the emergency vets. So she will connect his drip and make sure he's having fluids, and will make sure that he has painkillers. Now, I have to go back to my day, so I don't get to carry on with Henry at this stage. I have to leave Henry behind in the care of my nursing colleagues, say goodbye to his owners, and get on with the rest of my day. So I'm seeing my dog with an eye problem, and I will give that dog some eye cream, some treatments to try to help the eye problem heal, and I will go on and see the rabbit with the vaccination. When I'm done all of that, I then have to go look after Henry. So Henry, we took an x-ray of Henry, and so this is an x-ray of Henry. So the top that you're seeing is where his spine is, and the bottom that you're seeing that's kind of looking like a little black hill, the bottom right there is where his belly is going to be. The left of your picture is where his head's coming from, and the right is going to be where his tail is. And what I'm looking for is something really obvious. So something showing me that Henry has eaten something that's causing him an obstruction, so something in his belly that's causing a blockage, and so nothing's going in and nothing's coming out the other way. Usually, if it's something like a stone, it appears very bright and white, or if it's something like a bit of a metal, like a nail, it appears bright and white. Sometimes I can see lots of gas build up, so that appears very black. This is Henry's belly, and it's showing nothing. This is normal. This is what a normal dog's belly looks like. And I really wanted to put this case in there just to show you that sometimes there is no exact science to it. So some of being a vet, you have to use what's called your intuition or your gut, and you have to do something called pattern recognition. So part of recognizing the pattern here is that Henry's a dog that eats stuff he shouldn't. We don't know what he's eaten. It could be something causing a blockage, but he's never had a blockage before. Equally, he's never had this problem before. So what am I going to do? If he has a blockage, the consequences, I've got to open him up. So I've got to do surgery on Henry, and I've got to look for the blockage and remove it. If it's just that he's eaten a bit of a manky, a bit of a rotten food, kebab or something like that, and it's causing him a tummy ache, then I just treat him with medicine. So the consequences are very, very different. So I call his owners and tell his owners at this stage, I can't find anything, I don't know what's in there. And we have a conversation in my mind, because he is normally very bouncy and he normally eats kebabs and normally eats chips and bits of food that he finds in the field. it's quite likely that he would have come across some manky food before. But quite likely he was going to be exposed to rotten food in his life, and he's never had this problem. So in my mind, in terms of pattern recognition, this dog has got a blockage. So I am now going to do surgery on Henry, and I put this here to say Matt Mathers, because when I was in school, I remember doing things like algebra and stuff and thinking, like, when will I ever in the real world use this stuff? Well, you use it when you're a vet. So you have to work out things like dosages of medication for animals. So I need to give Henry a few injections, one to make him go to sleep so that I can do an operation on him, but I also need to give him things like antibiotics and painkillers, stronger ones than he was on before. So I really need to use my maths here, and algebra really comes in handy here, because a lot of it is using his weight against the dose and figuring out how much he needs and stuff. So I'm doing the calculations, and I'm going to give those numbers to my nursing colleagues, and they will give Henry his injections whilst I get myself prepared for surgery. So I've got to change into scrubs and get myself extremely sterile now because I'm going into surgery. So the team are preparing the dog and theatre, and I just want to say before we go ahead, there are a couple of slides. If you're very queasy, you might need to look away, because I put in a couple slides, just one of surgery and one of Henry recovering. So I don't think it's the next one, but it'll be coming up shortly. So this is the dog, and this is a dog, a picture of a dog, and Henry's blockage is going to be somewhere in that small intestine. So I need to do surgery, pull his small intestine, so examine his small intestine. So I need to get into his stomach area, into his belly area, get his small intestine out, have a look at it, see if there's a blockage. If there's a blockage at this stage, I don't know that for sure, and then recover him from surgery. So I think we're going into queasy slides now. So this is where I have made an incision into Henry's belly. It looks very pink because we have to shave all his hair off. So even if he's a black Labrador, when you get down to the skin, it is going to be very pink. So I have to cut through the skin layer, muscle layer, fat, and get into the stomach, and that's what I see. I then have to pull and do what's called a survey of his gut. So I start at the stomach, and I just have to pull through all his guts, and it should feel all very soft and squidgy until I feel something hard. And I felt something hard. So I'm feeling something that's hard, and it's hot, and it's red. So if you look, you see it looks kind of pink. The pinky stuff is his intestines. This bit looks really, really red. And I found it. It's a bit of a corn on the cob that Henry has eaten, and it's stuck and causing a problem. Remove it, and then I sew his guts back up, and then I sew Henry back up in terms of his muscles and skin, and I go on to recover him. So this one's a little bit, if you're squeamish as well, maybe look away. So this is going to be a picture of him recovering. So he still has a tube in his mouth, so that tube goes down to his lungs, and we help breathe for him. So in the meantime, when he's recovering from surgery, he's not conscious yet, he's not feeling pain yet, but he is off the anesthetic, and we're going to recover him at this stage and wake him up and see how he is. So he wakes up. So if you're squeamish, you can look back now. If he wakes up, he's not very happy. He is feeling very sorry for himself. But he is not bleeding. I found the problem. I've given him pain relief. So what do I do now? Well, it's time for me to have a break. So it's time for me to go to lunch and have really important in our day to make sure that we take time for making breaks and make time for ourselves, because when you can't really look after an animal if you don't really look after yourself properly. So we try to get ourselves a break. Sometimes that doesn't happen because emergencies come in and stuff, but we generally try to have a break. So I've got an hour. I'm going to have some lunch and then come back. So I put that picture there because basically when I come back, he's looking exactly the same. He is not very well. He's feeling very sorry for himself, a bit sore, a bit put out, missing his family, and I've got to go on with my consultation. So at this stage, I'm going on to look after the kittens and the puppies and all of the other things, that all of the other consultations or appointments that I have, and they're again going to be very varied. So I come back in at around 2 o'clock and I'll be consulting right through till 6 p.m. In that time, Henry's in the care of my nursing colleagues, and they know to find me should they need me as an emergency. Otherwise, I will just do spot checks on Henry and find out that he's okay. Now, in this situation, I've shown you Henry, and that's one surgery. There are times that I will do 5 of those surgeries in one day. There are times that I will do just 1 surgery. So, like I said, it is very, very varied. So, the end of my day is here at 6 o'clock, and Henry is looking very, very sorry for himself, and it's time for him to go home. So I've got to get him ready to go home, and he is actually going to go on not to home, but to an emergency vet. So he's going to go back to a vet, and they're going to look after him until he passes poo, and that we know that whatever comes in is coming out, so that we know the problem is no longer there and he's recovered really well from the surgery. And then I go home. So that's my day on an average day. And I really just wanted to show that, because at the end of the day, I've done the best that I can do, but I still didn't have, I got the problem. I knew what was wrong with Henry, but I won't know that he is really well and he's recovered until a couple days later, when he comes into me for a post-operative check. So he'll come to me and I'll check his wound and I'll make sure it's nice and healing nice. And that's when I know that he is fine. Because of the amount of people I see every day, it's really hard to check up with everybody all the time. So you might think to yourself, well, why don't you just call Henry the next day, Henry's owners the next day, and find out how he's doing? But the next day I'm going to be just as busy, if not busier. And so it's really difficult for me to kind of do that all the time. Sometimes I can if it's slow, but often it's not. So I just wanted to, at this stage, just lay out in terms of setbacks. That's my life and my day job. I think it's really important for people to be honest about any challenges that they have experienced and any setbacks that they have come across in their life as well. So in terms of me, I wanted to go to university to be a vet. I had that dream in my mind from a child, but I think when you're a teenager, there are other things that are more important to you at that time. But I kind of knew that it was always what I wanted to do, but just really wanted to say I was not great at school. I would be what you would call an average student. So I was not the top of my class. I always worked very, very hard, but I worked really hard for every mark I got. And I think I was a bit of a daydreamer. So I think not everyone took me very seriously when I said I wanted to be a vet. In terms of going through vet school, I think I learn really well practically. So I'm one of the people who learn by seeing and by doing. And so in my first few years of vet school, so the way that Edinburgh's degree is set out, you have the first few years of a very theoretical base, which means you're looking at books quite a lot and doing tests quite a lot. And I failed examinations going through vet school. So there were times when I just failed and I didn't get the marks required. And so in those 3 years, it was really, really tough. And I had failures in my second and third year. But then once I got to the 4th year and it was all practical and clinical and, dealing with animals and clients, I was so much better. I really found that I had arrived where I thought I was going to go in life. So, but just to say that I had challenges getting through. And I think that's really important, to be honest, so that you don't think that you have to be really, really smart, or you've got to get everything right, or you've got to learn in a particular way to be a vet. It takes all types of people, and it takes all types of brains to do it. And I think if you feel that you have any passion at all for animals, or any passion at all for people, for helping people, this is really a really, really positive way I have found to do that. So, my top tips for success. I wanted to put first, it's okay not to know, because I think I remember being in school and most of my friends at the time didn't know what they wanted to do and have made very successful lives for themselves. And I think it's and with very, very varied careers. So I think it's really important at your stage to know that it's okay not to know. But I think it's important to be fine and be okay with that. And if people ask you what you want to do when you grow up, it's okay to own, I don't know yet. That's absolutely fine. My top tip for success is be adaptable. I want to give you a bit of homework. So I would like you to ask at least 3 people in your life, 3 grown-ups, if their life has turned out the way they thought it would. And that's to show you that life does not turn out the way you think it would. And if you are brash enough and bold enough to think that that's just that lady on the webinar and actually my life's going to turn out exactly the way I planned, I can guarantee you it will not. And you need to be able to be adaptable with your life and have goals, have dreams, have visions, but understand that life will take you off the course that you intended for yourself. That's just how it works. So ask 3 people. If the majority of them say it has not turned out the way they thought it would, then trust me, I'm right. So be adaptable. Learn to have a goal in front of you, but be okay when life takes you off course. I think the most successful people I know are people who have kept their eye on the prize, so kept their eye on that North Star guiding them forward, but understood that they have to be flexible with things. And sometimes you're going to get setbacks. Sometimes life will knock you down, but that's all okay. And that's part of the journey. Some people have to take the scenic route. Some people take the faster route. That's all okay, but just really be adaptable with life as you move forward. Be curious. And I think, again, be curious, and that's really be curious about life. So make sure that you are wanting to know stuff. I think with your generation, it's so challenging because you have so much coming at you. You have information coming at you from all ends, and it's really difficult to know where to start looking for stuff. And I would say the answer to that for me, and again, this is my top tips, is to find silence. So to make sure you have some quiet space in your life where you can look to, you can be curious about what is making you excited, or what is making you happy, or what is driving you to think, or what new story is making you passionate, and those are the little clues that life is going to give you, and they're like breadcrumbs, and if you follow them, you will get to where you want to go. The next one is to have great expectations. I think have been, I've had people have mixed expectations of me throughout my life. I think your parents will have a certain set of expectations of you because they've known you all your life. Your teachers will have certain expectations of you because they know your academic performance. The thing that I have found most useful is to know myself and to have great expectations of myself. I think that has driven me in a way that nothing else quite has in my life. And I think if you're able to have great expectations for yourself, irregardless of what anybody tells you, the parents, teachers, random folks, it's not going to make a difference because you are going to have those expectations for yourself, set them higher than you think you can achieve, and move towards that destination. And I guarantee you, once you find the support, you will get there. And that last one is just follow your passion, find what you love. So follow that thing I was talking about, being curious about life, trying to learn, wanting to learn, and finding what you love and following your passion. And that will take you to what you're supposed to do. I know they say the future belongs to people who can do science and technology and medicine and maths and engineering. It belongs to those whose brain understand coding and things like that, but it also belongs to those who have heart. And I think you have to remember that it's not just about being a scientist, or it's not just about knowing maths and engineering, but it's also about having some passion, some love for it as well. So how do you become a vet? I've just put some resources here which I can share wider with everyone, given to have a platform, but these are some resources. BVEDS is the British Veterinary Ethnic Diversity Society, and they do have resources specifically tailored to people from an ethnic minority background. There's Vet Mentors as well. They have free programs for people wanting to become a vet, wanting to become vets, and the RCVS, which is the Royal College of Veterinary Surgeons, they have a guide into I want to be a vet and how you would go about doing that. Courses, that should say resources. And so, yeah, that's me. I'm now the president of the Royal College of Veterinary Surgeons. My children say that it means that I'm the top vet, so I'm the top vet in the United Kingdom. That's not really my title, but that's who I am right now. I am doing that role and very much really loving it at the moment. And social media, and any questions?
Awesome, thanks so much for that talk, Mandisa. It was really, really interesting. I didn't know much about being a vet either, so I think I've learned a thing or two in here. We've got a good few questions in the Q&A, so for anyone in the audience, if you have other questions, feel free to put them in the Q&A box, and if that's not working for you at all, pop them in the chat box so we can get through some of them in the next 20 minutes or so. So we've got a range of questions. I'm going to start with one that I think is my favourite because it's the most sort of specific. I think it was relating back to when you were showing your surgery pictures from Henry, and someone's asked, how do you put the intestines back in the back the way they were, which I just think is a really interesting question. So I guess, how do you make sure everything goes back in the right place?
Very good question. The quick answer is you don't. So everything comes out in order and you kind of just put it back in. What is supposed to happen is that what's called peristalsis, so that the guts are supposed to move themselves. And so what's supposed to happen is those guts, once Henry wakes up and and things start moving again, is that supposed to slowly find its way, almost like a snake, find its way back to where it's supposed to be. And that's generally how you do it. You try not to put things topsy-turvy, so you don't put it topsy-turvy, but in terms of putting it exactly as you found it, that's very rare to happen.
So it's more about not getting it in the wrong place rather than getting it in the precise same place.
Absolutely.
There's a couple sort of general questions around, I guess, your education. So what sort of things you did at GCSE or A-level or equivalents, how long was your university, how did you find the workload? So yeah, sort of general education questions, if you wouldn't mind sharing a little bit on that.
Yeah, absolutely. So I did 8 subjects for GCSEs. I was science stream, so I did biology, chemistry, maths, physics, and other things, geography, Spanish, etc. So I did 8 subjects at GCSE. I did the 3 sciences at A-level, biology, chemistry, physics. But I want to clarify that because I know I said I wasn't very smart, but it does sound like I am if I did biology, chemistry, physics. I did those things because I did not like maths. And that's why I was saying math matters, because I did not like maths and I didn't want to do it. And at that time when I went to vet school, so when I was preparing for vet school, the advice was you had to have at least 2 sciences and maths, or 3 sciences. So the only reason I did the 3 sciences was because I really wanted to be a vet. So that's that. In terms of university, Edinburgh University, it's a 5 to 7 year course. I did the scenic route. I took 7 years. And in terms of the workload, I think it is very challenging. But it goes back to that old saying that nothing that we're doing is easy, or something like that. I can't remember. But anyway, it's really hard, but it's worth it because it's something that makes a huge difference to your life once you graduate. So I hope I answered all the questions for that one.
Yeah, I think that covered a good few of the questions. Another question about Henry. I think people are very interested in Henry's story, and a really, really good question of what would you, if you during the surgery, if you hadn't found anything in Henry's intestines, what would have been your next steps? Which I think is quite an interesting one about sort of problem solving as well.
Yeah, that's a really good question. So I think I had spoken to Henry's owners about the possibility that I might not find anything because I'd x-rayed him and didn't find anything obvious. So what I would have done had I not found anything, given that he was not eating, I would do something called a biopsy, which is to take a little sample of his stomach, a little sample of his intestines, and we would look at that in a microscope and just check that that's all okay, because there had to be a reason that Henry hadn't been eating. Given that he was used to eating and used to scavenging food from when he had been out on walks. So I do something called a biopsy at that stage.
Also, I guess it's a case of knowing all your options and just constantly making the next best decision for the animal.
Absolutely. And I guess what I should say, for every time someone's gone in, a vet's gone in and found that corn in the cupboard and went, yes, like I was right. There are almost equal amount of times that one would go in and think, okay, there's nothing in here. It really is something, it is a gut feeling, and there have been people going in looking for something and not finding it. So there is no exact science with veterinary medicine. Clients often joke, if only they could talk to us, and I think it's really true. If only they could tell us where it hurts, it makes a huge difference, but unfortunately they can't, so we do have to just use judgment and intuition.
And luckily their owners can talk, so hopefully, as you were saying with the case of Henry, you could tell that at least whether this was a normal or abnormal experience for that animal. There's a few questions around the sort of challenges that you face, and you spoke a bit earlier about at one point not getting the grades you needed. And so someone's asked, did you feel disheartened by that and felt like you couldn't make it? And if so, how did you get through that? Because obviously you did go on to become a vet.
Yeah, I think for me, it has and has always been a constant state of picking myself back up. So I was saying before about having great expectations. I always had the greatest expectations to myself, and it did not always manifest. So sometimes I'd have this really big expectation, and then exams would come out and it did not look great. But it really was always very disheartening. I was when what I worked for didn't materialize, I always felt disheartened. But I always knew somewhere inside of me there was a small voice that said, you can do it, you can do it. So I just kept going. And I think that's really what I kind of want you all, if there's one thing I can get you all to do, is to get in touch with that voice that tells you that you can do it. Because it has been constant. Failure has been a constant companion of mine. But for every failure that I have had, I have always had a voice saying, just keep going. You'll be fine. I say that I've also had really supportive parents and a really supportive family that have also said, just keep going, you'll be fine. And I think once you have a support network as well as that voice inside of you, just keep going, you'll be fine.
Excellent. I think that's really good advice for all stages of life as well. There's been a few questions around work experience, and someone summed it up really nicely of saying that it's obviously a really important part of an application for veterinary school. Do you have any recommendations or tips for getting work experience, especially right now where obviously everything looks a little bit different at the moment?
Yeah, so that's a really good question, and I think it certainly is a challenge. I think the vet schools, in our communication with them, are not as focused on getting as much experience as they previously were. I think you have to be able to show in your application to vet school that you have considered what it means to be a vet, you have considered all aspects of the profession, and that you are willing to do it. And I think one of the things that in terms of challenges in finding stuff, there are a lot of online resources that people are offering, a lot of free online resources. If you can access those, I think that would be really useful, and it shows that you have been wanting and willing to do something. I think as well, maybe this is the time to try to access, I think I gave the link of BVEDs, but they have a few resources where there are residential work experience, so you can go stay at a farm or go stay at an equine practice, etc. And I think those are the things that maybe you could consider in this time, because they are going to be able to be socially distanced. You're going to be in a farm, you're going to be outdoors. They will always need an extra pair of hands. If that's not something that's possible, then really try to find your local charity or shelter and see if you can help with looking after animals in a local setting. And again, it's really just showing on your application that you have considered everything and you've tried everything that you possibly can. But no one is expecting anybody in this time to be shadowing a vet. No one is expecting anybody in this time to have loads and loads and loads of animal handling experience, because it is accepted that that is a challenge at this time.
Yeah, I think one of the few, I don't want to say good things about the pandemic, but at least it's affected everyone everywhere. It's not like it's affected one school, it's affected everyone. So anyone applying for university for anything in the next few years, they're going to be aware that things like work experience aren't the same as they maybe used to be.
Absolutely.
There's been a couple of questions around how you've dealt with maybe the sort of harder parts of your job. So someone asked about if an animal doesn't get better or if they pass away, and how you handle that, and also how you handle things around not being squeamish. So yeah, those sorts of maybe the harder parts of being a vet.
Yeah, thank you. I think I'll go with the squeamish ones first, and I'll give you a story of how I knew I would be a vet and not be squeamish. So when I was growing up, we had puppies. A dog had a litter of puppies, and the dogs, because I grew up in the Caribbean, they would sleep under the car, or they would rest under the car from the sun. And when the car was going, they would all kind of jump out of the way, and you kind of hear them scrambling and leaving. And so my dad got in the car and he turned on the engine, and the car started going, but one of the puppies didn't get out of the way. And I remember my siblings being very they were all teary and crying. And my first instinct was, what can we do? Like, how are we going to fix this? Do we need to get this dog to the vet? And I was very interested in problem solving as opposed to worried about the fact that my dad had just injured a puppy. And I knew then I'd be a vet. So I've never really been squeamish in the way that I don't mind seeing guts. The one thing I knew I couldn't do is do human medicine, because I knew I was squeamish about bodily fluids from humans. So I knew I couldn't do that. But in terms of animals, I was fine. And in terms of the harder parts of the job, so the bits particularly where we have to put animals to sleep, for example, I think that is something that you can never harden to. And there are still occasions where it breaks me, but I think there is an underlying understanding that if I can do nothing else to help that animal that day, then that is the kindest thing I can do for them. And it's very sad. It's the saddest for the family, because that's their beloved pet, and it's their home. Their life is never going to be the same after that moment. But it's the kindest thing I can do in that situation. And I think because I have, I guess, an overriding acceptance that that's the kindest thing I can do, it's something that I can do. I can get on with the job and do it. And the hard part of that is you have to do that in one consultation, in one appointment, and then the next appointment might be someone coming in with a brand new puppy, and you have to be as present with that family as you were with the one that has just put their puppy or their dog to sleep. So you have to be able to almost deal with it and move on, which I think is the hardest part of that, because you really want to be able to be present for the next family or be present for the next appointment, and not carry that with you. And I think that certainly is the hardest part of it all.
Yeah, that definitely sounds really challenging, but I guess again, it's nice for the family to know that you're acting on the best interest of their animal and helping them obviously work through that as well. You spoke a little earlier about sort of problem solving. I think it was the one when you spoke about the sort of Henry case in the question about his intestines. There's been a couple of questions about like what your most intense case has been, or where the answer wasn't easy to figure out, where you're most proud of your like problem solving. So I wonder if there's any particularly interesting or exciting case you'd like to share.
Gosh, I mean, the most interesting ones are the ones that are really obvious. So the most interesting ones are ones where like a dog's jumped on a trampoline and is completely hooked up into the trampoline and the springs of the trampoline. Those are the interesting things. Or when someone's gone fishing with their dog and the fish hooks ended up in the dog's lip. Or those are really kind of, oh my God, this has happened. So you get those, and those are very interesting. In terms of those complicated, having to think through ones, they are the ones where I've had to use my instinct and my gut more, because it's definitely a practice. And a lot of them are the kind of Henry ones, so the kind of ones where, and those are the ones that I am most proud of, where the answer is not obvious, but you've got to kind of think through in your head what is the most likely thing, and then also trust in yourself. And I think I spoke before about how failure has been my constant companion. But when you get into practice, when I get into practice and my intuition is so good, I can listen to it and it tends to be right quite a lot of the time, then that's really affirming that I'm doing the right thing, and I'm a good vet, and I'm helping animals and I'm helping their owners, because it's something where the answer's not obvious. I had a boss that used to say, you can train anyone to read a book, but you really have to be someone very special to be able to not look at the obvious and see the problem. And so I think that for me is the bit that, those are the bits that I'm most proud of. I'm sorry, I don't have a really fancy case that I did and I went, yeah, at the end of it. The really interesting ones to me are the ones where they come in with stuff stuck in them, and I've got to help take it out.
Yeah, and imagine working with pets, you probably come across a wide range of accidents and other things. There's been a few questions about whether you're aware of alternative routes to get into veterinary science, so whether there's routes outside of A-levels. I think someone asked specifically around like animal management college, and whether that's a route in. I don't know if that's something that you know anything about.
Yeah, I mean, I don't, the universities are going to be the place to go specifically for that information, but I do know that there are universities trying not to use the traditional routes as much. So Harper Adams Keele University has recently started a degree, and I know that they're asking for people with non-traditional routes of entry. So you can do vet nursing and go in, or you can do animal management and go in once they think you can handle the course. I think Nottingham University also has similar programs, and I know London University as well, the Royal Veterinary College, they have what's called a gateway program, which if you did A-levels, but you probably may not have gotten the best A-levels, they have a route for you to go in as well. I think you have to do A-levels but not get great ones, but it could be that you can not do A-levels either. But lots of the universities are doing what's called widening participation. So really trying to get people who can consider themselves kind of going to be effective vets and really be people who can help animal health and welfare into the course by non-traditional routes. So I'd just say contact any university and just ask them, and they'll probably be able to give you a better answer, a more specific answer, I should say, than what I just did.
I think in general, I think the way that most science and science-aligned subjects are going, there are becoming many more options for getting into it that aren't just the traditional route. So if you want to go into veterinary medicine or any sort of STEM subject that maybe in the past has been very A-level focused, these days there's usually alternate routes. It just might take a little bit longer to find them. I'm going to finish up with one last question that made me laugh, so I'm going to ask it to you. Have you ever been afraid of any of the animals that you've worked with?
Oh yeah, but not in the way you think. So the aggressive dogs. I have had people come in with aggressive dogs. Some people, you can say to them, you need to muzzle your dog, and they will be fine with it. And there's some people who will say, oh, he doesn't really like the muzzle, or he gets worse with the muzzle. And so when they're getting really, really aggressive, it can sometimes be very scary because you're just trying to help the animal. But in order to help them, you've got to touch them. You've got to kind of feel them from front to back. And sometimes if they're very aggressive, that can be very scary. But I mean, I've seen snakes and lizards and geckos and all sorts. I'm not afraid of any of those animals. I don't like frogs though, so I think if I saw a frog, I might be.
I find that amusing, the idea that you're fine with big scary dogs and snakes, but frogs is the no-go.
It's because they jump.
Awesome. Fran, did you want to sort of wrap up our session for the evening?
Yeah, so thank you so much for that. I think it's just so inspiring, and I just love, you know, find that voice inside you that says you can do it. I think that's such an important message. Thank you so much. So yeah, thank you on behalf of everyone who's attended. I did just want to share with everybody that we've got some other talks coming up as well. So next week we've got Dr. Marcia Philbin, who is the Chief Exec of the Faculty of Pharmaceutical Medicine. So if you would like to join there, there's a register there. And we've got Dr. Eric Fakua, who works in optoelectronic engineering from the University of Southampton as well. So he's going to be talking to us on the 24th of March. So these are both some cracking talks coming up in the future. And just finally, if you aren't already, you can sign up to our education update. So if you want to, you know, keep updated with latest news and advice, so this is the link here, or just check, you know, you can see us on Facebook, Twitter and Instagram, and or just email us if you've got any questions as well. So that was just my little bit there. Equally, if you do want to, if we haven't answered your questions and you have burning questions that you still want to ask, you can email us and I can forward them to you if you're happy. Mandisa, is that okay?
Yes, absolutely.
Fantastic. Thank you so much. That was amazing. We really enjoyed it.
Thank you very much. It's a pleasure.
Thank you.